welcome to this edition of Community Health Matters. I am your host, Kelly Davis. Today on this edition of Community Health Matters, we will be exploring mental and behavioral health services and treatment offered by Tri-City Medical Center. And our first guest, we are pleased to welcome Sharon Schultz, Chief Executive Nurse at Tri-City. Hi, Sharon.
Hi.
And thank you for joining us.
Good, thank you.
So what is your role at Tri-City Medical Center?
I am the Chief Nurse Executive, so I'm over all the nurses and some of the other areas in that, but the clinical areas mostly, but especially the nurses, yes.
So there seems to be a more awareness or attention that are being put on mental and behavioral health services. Why is that? What's going on there?
Well, I think over the past probably 10, 15 years, we've seen an increase. But in the past couple of years, we see more homeless people in our communities. There is less services. There's less reimbursement for outpatient, for inpatient services from insurance companies. And so I just think that with all the stresses in life and some more resources that are available and more newspaper writings that we see about it, that it's really brought more of an awareness. Our emergency department gets inundated sometimes with people that have behavioral problems, and so we are just trying to meet the needs of our community.
Is there a particular demographic that seems to be more affected by the...
We see all different ages, but I would say probably between 20 and 55 is the most amount of people that we see. We do see some as young as 9, 10 years old in our emergency department, and as old as you can be. It's hard sometimes to diagnose on the older patient, whether it's mental health, it could be Alzheimer's starting, it could be dementia. So there's a lot of assessments that you have to go through to be able to get to the right diagnosis of that. But for the majority, I would say it's between 20 and 55 years of age.
The demographic of who you see affected.
Right.
And the sort of $1 million question to me when I started to work on this segment, I saw mental health services, I saw behavioral health services. Is there a difference? Or
well, we believe there is. It's used interchangeably, but we believe that we call all of our areas behavioral health because behaviors can be changed. And because of that, that gives hope, right, to people. It's less stigmatizing of a term to use and more inclusive of not just mental health diagnosis, but addictions and substance abuses that are used in that. So we feel that that it's more acceptable in the community to use the term behavioral because people are always trying to change behaviors, whether it's weight loss, more exercise, doing more reading, doing more different things out in the community, in this wonderful community we have in San Diego.
Absolutely. So I would also imagine, that this concern is also a family affair, and the services that Tri-City Medical Center offers for the patients and the family. What services? Kind of a general idea of what?
We don't have family services per se. We do have referrals that we can give to families, and we do that all the time in the community to get them connected. We are looking for the future to have some community forums so that people become more aware of what is out there, what kind of help is available, and where to go, and what are some of the signs and symptoms early on that maybe we can help you with.
Is there a goal or an aim when you talk about behavioral services? I mean,
I think that our goal has been, which is why we worked with the county to get a contract for crisis stabilization, was to improve our access for behavioral health services in our community. We see probably just Tri-City alone has a population that we would cover well over 500,000. And so we wanted to make sure that we could do something to expand our services to the community. So our goal is to improve access, to improve timely intervention. If patients are sitting in an emergency department, they don't have the psychiatrist there or someone to intervene. We have psych liaisons that are family and mental health counselors, psychologists, but we really wanted to make sure that we provide more broad services to our community. And so we want that intervention to happen fast, which is why we opened up then the crisis stabilization unit. So patients move quickly through a medical screening exam in the emergency department by a medical physician into crisis stabilization by the mental health providers and psychiatrists, nurse practitioners, psychiatric nurses, mental health workers, and that.
We're going to be talking a little bit more about your crisis stabilization unit on the show, but before, is that inpatient or outpatient? What is that for, that crisis?
So crisis stabilization is outpatient. So we have an outpatient clinic, which is down on Vista Way. We have inpatient services, and so both of those we've had for a long time. We just opened up the crisis stabilization unit in September, and that's an outpatient that is geared to a 23-hour type of service where we have intensive services from social workers, nurse practitioners, psychiatrists, nurses, mental health nurses that really work with the patient. We also have family support and peer support from the county that we use to help intervene and provide resources, to do some counseling, to get patients the medications they need and the access to follow-up care.